for the third installment in this week's joint mobility series. We're going to finish up by covering thoracic spine mobility today. And I'd argue that this is the most important of the mobility exercises we got through, just because it so directly pertains to reversing some of the damage that our clients undergo as just part of their normal lives. They're typing too much, they're driving too much, whatever the activity, they're just spending too much time in this closed, rounded posture. And we've all seen the effects, especially over time, how we lose that ability to lift up, to extend out of the thoracic spine, and just how important that is for so many exercises. So if we can help our people start to foster that, their movements are going to look so much better for so much longer. So it's a little plug there. Really work this with your clients. The easiest way to start out with is just a seated spinal rotation. We're going to start by immobilizing the hips. You can either have the client squeeze an AirX pad between the knees, a yoga brick, something like that, or you can just trust them to sit up nice and tall and fix this whole region. We got a little bit of core activation, sitting up really tall. Once the hips and the lumbar spine set stable, we're going to add a little twist through the shoulders. And back to center. Back to center. Holding at the end range. And back. We're making sure that we're staying nice and stable here, nice and set, solid. No twisting to get a little bit of extra range. That's not the goal here. We're working within wherever you're at or wherever your client's at. That's the current range of motion that we're looking to expand. So be strict about what's going on in the lower region and focusing on more mobility, more lifting up out of the chest, out of the sternum. We can take this one step further, add a few different components to it by applying the same lifting mobility technique to the half kneeling position. We come down, I like this because it challenges the stability a little bit more, forces a little bit more core activation. We also get a really nice hip flexor stretch, as always. From here, making sure that the glute's really tight. Tight glute equals a stretched hip flexor complex. In this position, I'm going to take my left arm, post it across my right leg. And I'm going to use that to help pull my shoulders open into our rotation. To come the other way, plant my right arm inside my right leg and use that to push and open up out of the chest. Still tight here. I might glide forward a little bit. Open. Take it to the end range. Hold. And come back through. Get the other side next. Post. Lift up. Notice again, the shoulder isn't creeping up by my ear. That's that rounding tendency a lot of our clients are going to have. Want to pull the shoulder down. Again, we're trying to extend, lift up out of the sternum. Pull it down. That one's a great one. Obviously, just in the position you're in, works really well with the ankle mobilization that we went over, and the hip mobilization with the PVC pipe works great. We've got quick transitions there to get your agenda in before we move on to the rest of the workout. Last but not least, we're going to show you the rib pull bretzel. This one is a little bit more abstract. I suggest you try it out, play with it yourself a little bit, see where you can find some benefit, and then apply it to your clients. They may not understand it at first, but I've really found it to be very beneficial. it's all about the little nuances, the details, the minor adjustments that can have a huge impact when you add a load to an exercise. So if you're really strict on that, when you really understand this one, start applying it, and it can really be helpful for your clients. It's going to start very similar to crossover stretch that we're all familiar with. Lay on my back, cross one leg over and lay the hips to the side. Again, we've got the hips immobilized, and we're just working some rotation through the upper spine. Typically for the stretch, my hand would be posted on the leg. We're going to move that from the leg to gripping across the ribs. And working that action of rolling inward, similar to the dysfunction, and then reversing that, lifting out of the chest. You can even do a little wave pattern, flossing pattern, or just lift. Focus on pulling those shoulders to the floor, lifting up out of the chest, and keeping those shoulders unshrugged. They're not coming up by the ears. Once again, immobilized hips. Here's your stretch. Here's our rib pull bretzel. Lift. A little floss. Again, that's the rib pull bretzel. I'm going to suggest you try that one out on your own, see if you can find some benefit out of that, because it is all in the details, all in the nuances, so definitely feel that one first and then try it out with your clients. But it's just a great way to help really teach that spinal extension that we need for so many exercises: deadlift, squat, body row, just to name a few. That pattern's so important, but it oftentimes gets undermined by our clients' lives. So try that one out. Thoracic mobility exercises, consistency, and will really have your clients moving a lot better once they put the work in a little bit. Try it out. Let me know what you think. That'll wrap up this week's joint mobility series. Let me know questions, comments, concerns. I'd love to hear it all. All right. We'll talk to you soon. Bye.